Hi, this is the NEU's weekly report on COVID in schools. This week, continuing to report on big increases in outbreaks and also discussing the DfE's announcement on changes. So we can see that the graph for all ages across the UK is definitely going up steeply. The slope is as steep as it was in October last year, despite us currently having more restrictions than were in place at that time. You can see the slope is not different in the countries, except Scotland is quite a bit ahead. Scotland is like the northwest and the northeast. And on the regional breakdown, you can see that there, northeast, northwest, much higher than the rest of the country. When we look at school ages are above the all-age average. I guess not surprisingly, because children aren't vaccinated, but it does rather speak to the idea that children can pick up this virus and must be spreading it to one another. The rate for primary school children is such that you can expect 1 in every 110 children that you teach to have the virus. That's the same rate as the 6th of October. For secondary, year 7 to year 11, you can expect that 1 in 90 of the children that you teach have the virus. For all ages, it's 1 in 150 people have the virus. According to SAGE, the R rate for England is definitely above 1, bound to be with those increases between 1.2 and 1.5, an increase of between 3 and 7% per day, leading to these very big week-on-week increases. We can see that hospitalisation still remains low compared with where else it's been during the pandemic, but is starting to increase. Deaths also remain very low compared with where they were during the pandemic. Let's hope that carries on. But when we look at the other implications of allowing cases to rise, you can see that outbreaks in schools are now at the peak level they were in the autumn term. And there were outbreaks in 104 primary schools last week. That's 1 in every 170 primary schools. In 127 secondary schools, 1 in every 30 secondary schools. And in 20 special schools, 1 in every 80. And of course, that big increase in outbreaks is leading to children being off school. We put out a press release this week saying that Gavin Williamson, in our view, has just given up on this term altogether. We can see that the number of children who are self-isolating is increasing so fast because cases are going up. It's not true that schools are sending home more children than they should. They are following government guidance. And very large numbers of children were absent because of coronavirus. 8.5%, 640,000 pupils off school. And what is Gavin Williamson doing about it? He should be advocating for schools to use masks. He's stopped. He should be spending more time encouraging parents to use lateral flow devices with their children than to stay at home if they're positive, and he's not doing that. He should be working on ventilation like the New York City government is. He's not doing that. He has just given up on this term. So Gavin Williamson has just given up on this term and instead announced changes for the end of term and for next term. So he says from July the 19th that bubbles will come to an end, that NHS test and trace will be in charge of contact tracing rather than schools, that close contacts from September at least will be told to take a PCR test rather than isolate, that schools won't need to have bubbles or staggered starts, and before school restarts in the autumn, then children will be asked to do a PCR, an LFT test in school. But there are lots of questions that we have about this, not least on the practicalities. On this basis, from the weekend of the 17th and 18th of July, the end of term for many, heads will still have to identify and contact parents whose children have been close contacts, and then tell them that those children need to self-isolate for the next 10 days, the first day of the holidays. On the 19th of July, NHS Test and Trace will take over. But presumably heads that receive emails from parents will then have to still send them on to NHS Test and Trace. And then it raises a real question of whether children will know who their close contacts are, or whether they will come back and ask heads for that information. And we have a lot of questions about what's happening from September. Now, we hope that the government is clearly hoping for the best. The government is hoping that letting go of the restrictions now will mean that vaccination spreads and that people get infected and then they get immune and then cases will start to fall again. And we can see the hope in that. But hoping for the best isn't the same as the best becoming reality. So we've sent the DfE a number of questions that we think deserve urgent answers. Do they have any thresholds on case numbers or hospitalisations or deaths that would mean that the DfE would expect schools to do something different in September? When will their data from daily contact testing be available to the public and to other scientists so that we can see from that what the evidence on what contribution isolation was making to controlling cases, what contribution daily contact testing might make in contradistinction to that? Is there any part of the DfE's plan for the autumn term that will change depending on whether children are vaccinated or not? We've asked them what is their range of projection on the number of children that will contract COVID during the autumn term. And we know that children don't, the death rate for children is extraordinarily small. It's smaller than road traffic accidents, for example. But we've also asked what are their projections for the number of children that might suffer from long COVID or long COVID that will impact on their everyday life. It matters that we have some figures on that. We've asked them what they're doing about ventilation in schools in the autumn term as schools move into worse weather, especially in light of the DfE's own evidence, which says the World Health Organization has recently been updated, guidance has recently been updated to strongly reflect the role of aerosols in COVID transmission. This emphasises the importance of ventilation and the relative safety of outdoor settings. We've also asked them why they aren't doing the same as New York City, which is providing HEPA filters for every classroom. We've asked them their projections on what would happen to cases in long COVID if they maintained isolation, if they replaced it with daily contact testing, which they aren't currently intending, if they kept mask wearing, if they introduced those additional ventilation measures. Most of all, we've said to them, it's okay to hope for the best, but we can't plan on the best. We have to be planning for outcomes that are worse than the best. So we will be continuing to press the government on all of this. The vaccination continues to be the good news story. And we're now at a place where 86.6% of adults have had their first dose and nearly 65% have had 2 doses. Do go and get vaccinated. Try and bring your second dose forward to 8 weeks. Try and make sure you've had that second dose 3 weeks before the start of the autumn term. We've still got our other advice on the website, safety advice, education, recovery advice on our website there. Thank you for watching. Please share. Thanks for being a member of the union.